Hi, I'm Dr. Kara Sessoms. I'm the neurology department lead here at Gulf Coast Veterinary Specialists. And in neurology, we see a wide variety of cases and patients, mainly dogs and cats. IVDD stands for intervertebral disc disease. And in dogs, it's more common in chondrodystrophic breeds. So all of our short, squatty, cute-legged, low-to-the-ground dogs, Frenchies, Dachshunds, Shih Tzus. But if you think of it like a jelly-filled donut, the inside of their disc, the jelly, dehydrates and degenerates faster than other breeds. So the inside of that jelly herniates out through the outer cartilage layer and can compress nerve roots and spinal cord. Paraparesis, which is weakness, ataxia, which is wobbliness and incoordination, to complete paralysis.
So the difference in our patients, whether or not we see them as a scheduled appointment versus on an emergency basis, really depends on their clinical status when they show up, how painful they are, and how progressive their clinical signs have been. If a dog has been down or has been a little weak in their back legs for a few days to a week and they're somewhat static, we can technically see that as a scheduled appointment and work up things from there. In dogs that acutely lose the ability or become very weak within a 24-hour period or less, that is when we highly recommend that owners bring them through the ER and potentially transfer to us same day for further workup.
I think of 3 situations with IVDD when I would really recommend MRI and possibly surgical intervention. So if you've already treated for just pain with conservative management, meaning medications, rest, and the dog is still very, very painful. If they're acutely paraplegic, that's always considered a surgical emergency because we want to do surgery before they lose sensation in their limbs. Or if they're declining and getting progressively weaker, like one day they're walking and then they're falling and dragging a leg. So pain, non-responsive to meds, complete paralysis, or just progressive weakening of the patient. To prepare for your appointment at Gulf Coast Veterinary Specialists, if your dog is suspected to have IVDD, or cat even, the neurologist will examine your pet and talk to you about their findings. We'll review all your regular vet's records and any previous diagnostics. Typically, we recommend an MRI, sometimes a CT, depending on the case. But both of those advanced imaging modalities would have to be done under general anesthesia. So we will want recent blood work to evaluate organ function, the patient being fasted, empty stomach, and then in older dogs, chest x-rays just to look at the size and shape of the heart and make sure we're good for anesthesia as well. As a doctor, I would always recommend pet owners try to have pet insurance just to be proactive in their own animals' healthcare and for those unexpected medical issues that might come up over life. At Gulf Coast, we also offer several payment plans that you can apply for during your consultation.